Okay, 1 second. Let me get us to the PowerPoint. Continue to the screen. Yeah, that's what I'm trying to do. Why is it not escape? There we go. Perfect. Okay. View slideshow. Okay. Okay, so my name is Grace, and the disease that I chose to represent was Parkinson's disease. So during this presentation, we're going to talk about the central nervous system and its importance. We are going to talk about statistics regarding Parkinson's disease, risk factors, for developing Parkinson's. We're going to talk about the pathophysiology behind this disease, symptoms and progression, care needed at each stage, prognosis, and the treatments for PD. So the central nervous system is made up of the spinal cord and the brain, and this is what is affected in patients that have Parkinson's disease. Okay, so the central nervous system, which we just said is made up of the brain and the spinal cord. The spinal cord specifically is the interface between the brain and the body. The brain receives sensory information from the spinal cord, and it interprets it and makes intelligent decisions to maintain our health. The spinal cord, if it's injured, this can result in paralysis, and damage to the brain can result in impaired thinking and behavior or movement disturbances. Okay, here are some statistics for you. So almost 1 million people in the USA have Parkinson's disease. The average age that a person develops Parkinson's disease is 60 years old. And Parkinson's is the second most common neurodegenerative disease after Alzheimer's disease. The risk factors for developing Parkinson's disease are gender, genetics, age, injury, and environment. Men are more likely to get Parkinson's disease than women are. Age is a big risk factor. The older a person gets, the more likely they are to develop Parkinson's disease, as well as if they have a parent or a sibling with Parkinson's, which would increase the risk by 50%. Injury and environmental exposure to chemicals or toxins are also believed to increase the risk of developing Parkinson's. So here is the specific part of the brain which is affected, which is the substantia nigra, which you can see, this is a little sliver right here, which is called the substantia nigra, and this is within the basal ganglia of the brain. Okay, so this is how the neurons in that specific part of the brain are affected. So these Lewy bodies right here affect the neurons and the way that they work, as well as mitochondrial dysfunction occurs in the neurons. And this creates the effects, the movement disturbances that PD patients have. An important thing to know is that these Lewy bodies are also present in patients that have Alzheimer's disease as well, which suggests that there may be some similarities between the two disorders. Okay, move myself up here. So Parkinson's disease is a progressive degenerative disease that affects the CNS, and degeneration to the substantia nigra leads to a scarcity or lack of dopamine, which causes the movement disturbances. And then, as mentioned, mitochondrial dysfunction and the accumulation of Lewy bodies within the neurons is what causes this disease. But what specifically triggers the mitochondrial dysfunction in the presence of those Lewy bodies is unknown. Norepinephrine neurons are also believed to decrease, which can cause secondary symptoms in people that have PD. Treatments are available, but however, right now there is no cure. Okay, early Parkinson's might look like muscle weakness and pain, general fatigue, slight tremors in the hands that go away when the person is asleep, less spontaneity when changing facial expressions, as well as decreased flexibility. And unfortunately, depression is also very common in patients that have PD. Okay. Physical and occupational speech and speech therapy are beneficial for people that have Parkinson's. And depending on how advanced the muscular weakness is, a person with PD, even early on, may need to use a cane just to reduce their risk of falling. Okay, so as the disease progresses, there are some additional symptoms, which are pronounced tremors that affect the daily activities, delayed movement, postural changes like stooping down, and gait changes or changes in the way that the person walks. And a person with moderate Parkinson's disease may need a caregiver or somebody to help them out with some activities like dressing and eating because of the muscle tremors. And as a person progressively degenerates, or what's the word? As a person gets sicker, I guess you could say, they are at a higher risk for falling, so they may need some assistance when walking, and they may need a cane or a walker. Okay. Advanced Parkinson's looks like vocal changes because of dysarthria, difficulty chewing and swallowing food, moving the face, eyelids, and mouth, urinary retention as well as constipation, orthostatic hypotension as well as an irregular blood pressure all the time, decreased digestive activity, and dementia. So care needed for a person at this stage. So the patient might need help with walking, dressing, eating, showering, and toileting. So they may need a caregiver full time, or they may need to be in a skilled nursing facility. Thickened liquids and soft foods might be required. Urinary catheterization might be necessary. The use of a walker or cane if the person is ambulatory, and physical therapy as well as OT and ST or speech therapy may also be very helpful. Psychotherapy if it's needed, because depression is common with this disease, and it's a degenerative disease, and that's very hard to comprehend. Respiratory infections are common in advanced stages of Parkinson's disease, and that's likely due to the higher risk of aspiration because of the dysarthria. Urinary tract infections are also common, and that's probably due to the prevalence of urinary catheterization use. Okay, so prognosis and treatments. So even though this is a degenerative disease, people with PD often live a full lifespan. Right now, unfortunately, it is incurable, but there are medications and surgical operations, there's 2 of them, that are commonly used to treat patients that have PD. So the medications that are offered are meds like levodopa, And what those are synthetic versions of dopamine. And this is used to lessen the tremors that patients with PD have. Antidepressants might be prescribed to a person with PD if they are suffering from depression because of the disease. Like I mentioned before, therapy will be used if necessary. And Duopa and deep brain stimulation are the two common surgical operations that are used to treat PD, which we're going to talk about a little more in the next few slides. Okay. So, other treatment options, these are things that may be more popular in the future to treat Parkinson's. Transcranial magnetic stimulation to help with motor symptoms, stem cell replacement therapy, and FMT, which we just talked about a week ago. So here is about the Duopa operation. And this operation involves creating a stoma, and a PEG J tube is used that is connected to a portable pump to continuously provide the patient with medication. And this means that the patient will have less gaps of time in between doses of medication. The most common side effects from this operation are hypertension, nausea, edema, tubing placement complication, pain in the mouth and throat, and depression. Okay. So this is a little bit about DBS operation, and what this is electrodes are placed in the brain, specifically oftentimes the subthalamic nucleus or the globus pallidus interna of the brain. And this electrically stimulates the neurons that are abnormally depolarizing and causing the motor dysfunction in PD patients. The electrodes are connected to a battery-operated device that looks very similar to a cardiac pacemaker. And as you can see, this is Michael J. Fox with his implant. Go. Okay, so this is a summary of what we've learned. So PD is a degenerative disease that affects the CNS and is currently incurable. And degeneration of the substantia nigra of the brain leads to the muscle weakness and tremors, as well as the gait and posture changes in PD patients. The exact cause of what triggers the mitochondrial dysfunction of the neurons and the presence of the Lewy bodies is unknown. Men are more likely to develop PD than women are, but patients do live a full lifespan with this disease. Age, environment, genetics, injuries, and I don't know why I said environment twice. Whoops. Those are some of the risk factors for developing it. And the primary treatments, which we just discussed, are medications, surgical operations, and physical, occupational, and speech therapy. Okay, so thanks for listening. I hope you found this presentation interesting and informal. See ya.